lot of times patients come to me as their third or fourth opinion for hip pain, thinking that there's no answer to their problem. When I examine the images and I examine the patient, and I do think that they're a candidate for hip arthroscopy, and we discuss this with them, they're very excited about the opportunity to potentially address their pain. A lot of them have been in pain for years and have been told there's nothing that can be done for this hip pain until they need a hip replacement, and hip replacements are something that patients try to avoid at all costs. So hip arthroscopy is it's a procedure that allows us to do a minimally invasive surgery to the hip to address things like labral tears and cartilage damage in the hip. And by doing that, it's considered a hip preservation surgery, and it allows the patient to have relief of their symptoms. Recovery time is typically crutches for 3 weeks, and then they're back to day-to-day activities relatively quickly. Sports takes about 4 to 6 months to return to, but ultimately the return to sports and the success rate is very high with this surgery. Hip arthroscopy is not for everybody. It's for the patient without significant hip arthritis who's trying to prevent the development of hip arthritis. In those patients, the success and the outcomes are excellent, and patients return to things very quickly after that. And then when we ultimately go through with the surgery and their pain resolves, which they've been told for an extended period of time is not something that will happen until they have a hip replacement, they're very pleased.